Hare Rama, Hare Rama, Hare Hare. We are starting head and neck. Hello. But, maybe you can send a message or anything. We are starting very rapidly. Philosophy and critical care. I will read all the answers.
Yes, what?
Very rapidly because
Stations, question.
yes, like the before we did.
Like the mock we have in the PDF.
Sorry,
If there is
you can.
thing added to it,
Sorry.
there is a new, it contains a new questions here.
This is my note. I tried to add new questions.
It
Whatever.
just collected them.
No, no, no. This is while I was preparing. I okay. Mm, so station one, identify structure A to N. Structure A is structure E, anterior border of sternocleidomastoid. Structure uh, E, sternocleidomastoid anterior border. F, sternoclavicular joint. G, pectoralis major. H, posterior belly of digestive. I, splenius capitis. J, posterior border of sternocleidomastoid. K, I think K, splenius medius. L, trapezius.
K is please what?
K, K is L is trapezius. M is inferior belly cervical 2-3. Great auricular nerve, rotator cervical 2-3, sensory distribution, lower half of the auricle and skin over the parotid gland and angle of the mandible. Skin, lower nerve, D, supraclavicular, supraclavicular nerve, and E is trunk of the brachial plexus. Now identify the head to the turn the head to the contralateral side against resistance. If it is injured in the posterior triangle, which muscle will be affected? Trapezius only. Identify omohyoid muscle 24. Just before we have seen in the main picture. Uh, you can ask the question, Asma, if you want,
Okay.
or and you can give a text to Esther also. Yeah,
What?
you can send a message to Esther to join. Identify omohyoid muscle. Omohyoid muscle superior belly is 54, inferior belly 21. What is the nerve supply?
The question wait for me.
Yeah.
Okay. Okay, that's continue. Identify omohyoid. You said 40, 54 and 21. Okay. What is the nerve supply of omohyoid?
Nerve supply answer cervical is root value cervical 1, 2, 3.
Identify submandibular gland.
Submandibular gland number 33. Lingual nerve, it carries general sensation of the anterior two-thirds of the tongue.
Okay. What is the muscle lying between the gland and the skin?
Platysma muscle.
What is nerve supply?
Cervical branch of the facial nerve.
How to test it?
Ask the patient to tense his neck muscle.
What is the muscle that divides the gland into superficial and deep parts?
It is mylohyoid muscle. Mylohyoid muscle.
And what is nerve supply?
It is mylohyoid nerve. It is innervated. It initiates swallowing by elevate the hyoid bone, elevate the oral cavity, and depress the mandible. Elevate the hyoid bone, elevate the oral cavity, elevate hyoid bone, elevate oral cavity, and depress the mandible.
Okay. Type of secretion of submandibular gland.
Submandibular mixed, both serous and mucus.
Okay, identify structure number 9 and function of it.
It gives motor sub.
What muscle elevates the posterior of the tongue?
Palatoglossus.
Mhm.
Glossas. Okay. So.
Did you hear now?
Yeah, I can hear you.
Okay. Which muscle elevates the posterior of the tongue?
Palatoglossus, 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 styloglossus, hyoglossus.
Reticulosus, styloglossus, and the hyoglossus. Hyoglossus injury, what happened?
Tongue will be deviated to the affected side. Side to side movement will be affected. There will be tongue atrophy and difficulty in speech articulation.
Yes, difficulty in speech articulation. Okay. What is the boundary?
The posterior belly of digestive. Base by mandible. Flow group I don't know, and it is supplied by post anterior belly is supplied by nerve to mylohyoid, mylohyoid, and
Okay.
its content mylohyoid. Okay, mylohyoid muscle. Okay, submandibular ganglion, submandibular gland, submandibular lymph node, submandibular ganglion, facial artery, and hypoglossal nerve. Facial artery, common facial vein, skin.
No, the screen is gone. Okay, تعملي بطريقة.
You were sleeping, Esther?
Yeah.
Yes.
The show asked me for 4 minutes and we came after the 1 hour.
Yeah, I became also tired.
His timing are very accurate. You too. Also said I will reply. Not 1 hour.
Okay, now can see the screen. The neck. It is divided by anterior triangle of the neck. It has both right side and left side, and it is divided by midline, anteriorly midline of the neck, and then superiorly lower border of the mandible, and um, subtriangle divided by above digestive mylohyoid. This is not no need. Submandibular or digestive triangle. Already we have seen submandibular. This is carotid triangle and back posterior. Now, the patient has enlarged lymph node. Biopsy taken. Diagnosis, please. Okay, this is I can see hyperchromatic nuclei, increased mitosis, hyperchromatic nuclei ratio, hyperchromatic nuclei, increased mitosis, increased nuclear cytoplasmic ratio. Cool. Otherwise, I don't see any difference. Hyperchromatic nuclei, increased mitosis, hyperchromatic nuclei, increased mitosis, and increased nuclear cytoplasmic ratio. These are or malignancy. hyperchromatic nuclei, then increased mitosis and increased nuclear cytoplasmic ratio. So it could be malignant melanoma or squamous cell carcinoma. Same thing, hyperchromatic nuclei, increased mitosis and increased nuclear cytoplasmic ratio. So it should be malignant melanoma or squamous cell carcinoma. So we will go very rapidly. These all are repeated, multiple repeated.
What?
I mean,
What you saying?
we need to go abdomen,
Okay.
thorax.
Identify the organ in the picture.
It is thyroid gland. It is thyroid artery from the thyrocervical trunk from subclavian artery, the first part, and thyroid in 10% population from the brachiocephalic artery or arch of aorta. Venous drainage, superior and medial thyroid vein into inferior tubular vein, inferior thyroid vein into left brachiocephalic vein, and lymphatic drainage, lymphatic pre-laryngeal, pre-tracheal, paratracheal, upper and lower cervical, and brachiocephalic lymph node,
Mm-hmm.
mainly by middle cervical ganglion.
Embryology of thyroid.
Length of the length from the tip of the tongue, and then it pass forward and loop around and under the hyoid bone.
What is the thyroglosal cyst?
Thyroglossal cyst is a fibrous cyst which is formed by the persistent thyroglossal duct.
What is the supply of recurrent laryngeal nerve?
Recurrent laryngeal nerve supply all the extensive muscle of the larynx except cricothyroid is supplied by external laryngeal nerve, and it supplies the mucous membrane. It supplies the mucous membrane of the larynx below the vocal cord.
To lose the vocal side.
During thyroidectomy, yeah, cervical sympathetic chain, recurrent laryngeal nerve, external laryngeal nerve, and cervical sympathetic chain.
What is the clinical picture of injury?
Recurrent laryngeal nerve, if it is injured, complete unilateral, there will be hoarseness of voice. Complete,
Yes.
complete unilateral hoarseness of voice, and complete both side aphonia. Again, complete recurrent laryngeal nerve, complete one side hoarseness of voice, and both side little stridor. PDS, partial unilateral dyspnea and both side stridor. But complete, one side complete patient will have of voice, hoarseness of voice. Stridor will be both side. If there is partial, not complete, then will be stridor. If complete in both side, no sound at all, that is aphonia. But if only one side, there will be hoarseness of voice. Hoarseness of voice. Complete but one side, hoarseness of voice. And partial, only one side, there will be dyspnea, and both side partial, there will be stridor. Okay, and external laryngeal nerve, abnormalities in speech, inability to sing with smooth change to each higher note, and cervical sympathetic chain will be
Okay, identify following. 42,
42 superior orbital fissure,
14,
14 foramen spinosum,
13,
13 foramen rotundum,
12.
foramen ovale.
Okay, and optic canal. Okay, uh, okay, okay, vegetable.
27.
Blue.
27. Yes, this is hypoglossal.
Okay. Mention me the structure passing through each foramen of research.
Superior orbital fissure, there will be frontal lacrimal and necessarily branch of the ophthalmic oculomotor nerve, superior and inferior division of the ophthalmic vein, then trochlear and abducent nerve.
Structure of the producing superior and inferior oculomotor. We
First, I will say this one, lacrimal ephelin, then superior and inferior division of the oculomotor nerve, then same superior and inferior division of the ophthalmic vein, then remaining trochlear and abductor.
optimal frontal and basopharyngeal branch of ophthalmic nerve or ophthalmic artery.
Ophthalmic vein or lacrimal ephelin, ephelin,
Surgery
frontal
they mean it's ophthalmic nerve or artery.
are branch of V1.
Okay.
Yes, they are branch of the ophthalmic division of the trigeminal nerve.
Okay.
V3, V1 is ophthalmic. Whole 3. So we come from this direction. Frontal, lacrimal, and nasociliary division of ophthalmic nerve, optic ganglion, V3 is a mandibular division of the trigeminal nerve, accessory meningeal artery, laser petrosal nerve, emissary vein. Rotundum maxillary nerve. Foramen rotundum maxillary nerve. Rotundum maxillary.
Okay. The maxillary gives the cheeks which are round so we don't. Optic canal. Right.
Sorry?
تحشيش تعبت.
Caption?
She liked the pneumatic, I said.
Which one?
You didn't understand it. I say maxillary gives the cheek. The cheek is round. So it's foramen rotundum.
Round is rotundum.
Yes.
Okay.
Optic canal.
Optic canal, optic nerve, ophthalmic artery, and optic canal actually meninges. Then ophthalmic artery and sympathetic nerve. Optic nerve
Three
with
layers.
3 layers of meninges. That's why raised intracranial pressure may come as like papilloedema.
Uh-huh.
So optic
Okay.
canal, optic nerve, ophthalmic artery, and sympathetic nerve.
Clevis.
Clevis abducent nerve.
What's the artery pass in optic canal and what's its significance?
Labyrinthine artery and vein. Labyrinthine artery plus vein.
You're asking about the artery.
Oh, artery, yes. Labyrinthine artery. Okay.
What is the significance?
No. Sorry. Artery passing to the optic canal. Canal is optic canal ophthalmic artery. Ophthalmic artery, it gives central retinal artery, which is the end artery.
Yes. Ganglion.
You are saying from very far.
Sorry?
Your voice coming from very far, another side of the sea.
You can hear me?
A little better now.
Okay. Better now?
Yes. Terminal ganglion situated. What is the trigeminal ganglion situated? Trigeminal ganglion situated in area number 38. Here in the picture, area number 38. It is called tegment tympani.
Segment timpani number what?
38.
38. Okay. And what is the structure passed through the cavernous sinus?
Through the cavern,
Sorry.
internal carotid and abducens.
Mm-hmm.
Vein and ophthalmic vein, those are valveless veins. So if any infection directly can spread to the cavernous sinus.
Infection from dangerous area of the face, especially to the cavernous sinus as the training or blood place which causes cavernous sinus. Okay. Identify pituitary stalk and abducens nerve in the photo.
Pituitary stalk 26 and abducens nerve number 1 and pituitary stalk 26. Pituitary stalk 20
Yes.
and this is 1. Is orbital plate of the frontal bone. Number 2, internal carotid artery. Number 3, cavernous sinus. Number 4, oculomotor nerve. Number 5, ophthalmic nerve. 6, spinal cord transected. Number 1, orbital plate of the frontal bone. Orbital plate of the frontal bone. And 2, internal carotid artery. 3, carotid sinus. 4, oculomotor. 4, oculomotor. 4, oculomotor. 4, oculomotor nerve. Oculomotor. Motor. Then ophthalmic. Oculomotor nerve. Then ophthalmic nerve. Oculomotor nerve. Ophthalmic nerve. And then spinal cord.
Okay.
Superior rectus, inferior rectus, medial rectus, inferior oblique, superior palpebral conjunctiva, levator palpebral conjunctiva, and sphincter pupillae. And
What is the
only remaining 2, SO4 and LR6. Apart from these, all are supplied by these 3. SO4 is superior oblique by trochlear, and LR lateral rectus by abducens. Remaining all are by oculomotor. That's why when there is any oculomotor nerve compression or injury, this all will stop functioning. Only these two downwards. It goes downwards eyeball, and superior rectus they will pull it downwards. As a result, the eye will look like this.
nerve is affected due to high intracranial pressure?
Mydriasis. So, ocular pressure causes compression of the oculomotor nerve and it causes the paralysis. So there will be paralysis of the parasympathetic function over the sphincter pupillae, which is supplied with the oculomotor nerve. So unopposed function of the sympathetic function causes dilatation of the pupil.
Increase the intracranial pressure, compression of the inflammatory nerve, the parasympathetic supply be affected during the sympathetic report. Okay. What is the position of the eye and eyelid when the nerve is compressed?
Position of the eye will be displaced outward and downward and goes downward
Why
downward
downward?
downward because of the unopposed function of the superior oblique, and outward because of the unopposed function of the lateral rectus.
What does what what about upper eyelid?
Upper eyelid will drop, it will cause ptosis
Why ptosis?
because levator palpebral superioris will be paralyzed.
Lateral pelvis superiorus. Okay. And what does the trochlear nerve supply?
Abducens supply lateral rectus.
What is the first localizing sign?
It is a neurological sign that reflects some dysfunction from the area of its it is a neurological sign that reflects dysfunction which is distant from its expected anatomical location of pathology. It is a neurological sign that reflection which is distal from the expected anatomical locus of pathology. Example: raised intracranial pressure causes okay.
Return the question again, please.
It is a neurological sign which reflects dysfunction distant from the expected anatomical locus of pathology. Example: raised intracranial pressure. It is happening inside the brain, but patient having
Mm.
was in the eye, but
Mhm.
the exact pathology is in the tentorium cerebelli anteriorly, tentorium anteriorly with the ethmoid bone, posteriorly with the petrous part of the temporal bone.
It was part of the temporal bone and cerebellum. The answer here is wrong.
Anteriorly, it is the
It's written in the question.
anteriorly it is in the squamous part of brain. Don't worry.
Sorry?
We will get this question again, then we can clarify. Ethmoid bone, posteriorly occipital bone. Flex cerebelli, anteriorly ethmoid bone, posteriorly anterior flex cerebelli, it is downward. So anteriorly ethmoid bone, posteriorly occipital bone.
What are the attachments of pharynx cerebelli?
Flex cerebelli, anteriorly ethmoid bone. No, anteriorly cristagalli and posteriorly flex cerebelli.
Cerebelli, not cerebelli.
Cerebelli,
No, no, cerebelli.
cerebelli. It's a cerebelli.
Cerebelli. No, L.
Hmm.
Okay, anterior cristagalli and pharynx cerebelli.
Okay. Fast. In
Most,
5 minutes we will finish.
most aggressive glioma,
Glioblastoma multiforme.
bone, and before reaching the brain.
Dura mater. After skull, dura mater, and before brain is pia mater.
Mm. Where CSF is located.
CSF located in the ventricle of the
If a lesion arises from the central gyrus, which part of the skull will be involved?
parietal.
And what is the artery supply middle region of the brain?
Middle cerebral artery.
And what is the artery?
Medial in the medial region of the anterior cerebral artery. Papillary edema. Hello. Hello. Hello.
Hmm? Doubt.
Okay, I will try to read little rapidly here. It is like we are already. You can follow. What is the anatomical explanation of the raised ICP leading to papillary edema? It is transmitted through the optic nerve and can cause papillary edema. Ear related everything from the three. One is direct erosion of the bone, infected thrombophlebitis of the emissary vein, and mastoid infection of the bone, infected thrombophlebitis of the emissary vein, and mastoid hair cells. If infection of the middle ear with other cavity rather than tympanic membrane may affect, it is mastoid hair cell and mastoid antrum. Which cranial nerve run between the tympanic membrane and the mastoid hair cell? Facial nerve. What bones constitute the floor of the middle cranial fossa? Floor of the two. One is sphenoid and temporal. Sphenoid and temporal bone forms the floor of the middle cranial fossa. Sphenoid and temporal. By which route might infection spread from the face to the cavernous sinus through the ophthalmic vein and facial vein, which are valveless? What clinical sign of the cavernous sinus thrombosis, painful proptosis, third, fourth, and sixth cranial nerve ophthalmoplegia, gradual loss of vision, and sign of meningitis? Mention the medial cranial fossa boundary anteriorly, laser wing of the sphenoid and anterior clinoid process. Posteriorly, petrous part of the temporal bone and dorsum silla, and laterally squamous part of the temporal bone. In extradural hemorrhage, bridging vein and cerebral vein, bridging vein and cerebral vein. How does ICP affect oculomotor nerve? Herniation of the medial temporal lobe due to increased ICP will compress it against the petrous part of the temporal bone, and increase in ICP oculomotor nerve pulse. Patient will have dilated pupil occurred by compression of the oculomotor nerve at the attachment of the tentorium cerebelli at superior border of the petrous part of the temporal bone. Where is it is compressed against the petrous part of the temporal bone. High ICP consequence: projectile vomiting, morning headache, loss of consciousness, seizure, blurring, irregular respiration. High BP, decreased heart rate, and irregular respiration. Do both nerves, oculomotor nerves, been damaged at the same time or one after another? What is false localization sign? Emitter and before brain pyometer. CSF located in the ventricle of the brain, around the brain and the spinal cord in subarachnoid space. If lesion arises from the central gyrus, which part of supply the middle region, middle meningeal, middle cerebral artery? From where does the oculomotor nerve midbrain? How does it come to the skull? Oculomotor nerve, superior orbital fissure. What is the first sign of compression due to the high ICP? Papillomydriasis. Dilated pupil mydriasis. What is the muscle affected when ptosis occur? Levator palpebral superioris. What is the structure related to the silla turcica? Pituitary gland. Talk about the surface anatomy of the parotid gland. Parotid gland, upper end anterior border, posterior. Upper end curved line from the tragus to the center of the mastoid. Anterior border aligned from the tragus to the ear, to the center of the a line from the tragus of the ear to the posterior border of the masseter, then to the point 2 centimeter below and behind the angle of the mandible, and posterior border straight line from the mastoid process to a point 2 centimeter below and behind the angle of the mandible. Talk about the surface anatomy of the parotid duct. It is the intertracheal notch to the angle of the mouth. Where does it open? It parts the masseter. Uh, where does it open? It runs over the masseter, parts the buccinator, and then opens in the vestibule of the mouth, opposite the second upper molar teeth. Where the differential diagnosis of the parotid swelling? What are the differential parotid swelling? Parotid swelling infection by mumps parotitis, obstruction due to calculus or external compression, neoplasm, pleomorphic adenoma, and Barthen's tumor, and deep parotid lymph node. What is the most common benign pleomorphic adenoma and malignant mucoepidermal carcinoma? Facial nerve exit through the skull through sternocleidomastoid foramen, demonstrate the terminal branches, zygomatic, temporal, zygomatic, buccal, marginal mandibular, and cervical. What are the other branches of the facial nerve? Facial nerve in the facial canal, CNG, chorda tympani, nerve to stapedius, and greater petrosal nerve. Chorda tympani, nerve to stapedius, and greater petrosal nerve. After leaving the skull, nerve to stylohyoid, nerve to posterior of the digestive, and posterior auricular nerve. Where to palpate facial artery? In the inferior border of the mandible, anterior surface of the masseter. adjacent to the anterior border of the mesentery. In case of injury or ligation of the facial artery, what will happen? Nothing will happen because it has reached anastomosis of the contralateral vessel. Would it be possible to ligate? Yes, it will be reach anastomosis with the contralateral vessel. This is identify the pathology of the MRI. Parasagittal hyperdense mass, parasagittal hyperdense mass, parasagittal hyperdense mass, which calls meningioma, which three structure may affect superior sagittal sinus, then motor area, and cerebral hemisphere. Motor area, cerebral hemisphere. Cerebral hemisphere. What is the clinical picture of monoparesis? Monoparesis of the contralateral lower limb. Monoparesis Monoparesis of the contralateral lower limb. Monoparesis of the contralateral lower limb. Monoparesis of the contralateral lower limb. Monoparesis. Cerebral hemisphere, monoparesis of the contralateral lower limb. What are the brain? What area of the brain affected? Area number 4. Which layer of the meninges is meningioma? Covering to who identify the following structure? Pituitary gland in skull. Show the codes. Okay. Okay. All dural sinus will come to the conclusion sinus. Okay, internal jugular vein. Okay. Superior sagittal sinus with occipital sinus. They drain into straight sinus. Confluence of sinus with inferior cerebral vein. They drain into transverse sinus. Confluence of sinus joined with inferior cerebral joined with superior petrosal sinus and drain into sigmoid sinus. Sigmoid sinus joined with inferior petrosal sinus and they drain into internal jugular vein. Ah, there is a diagram. Tarsica, lateral to the lateral side of the tarsica. What blood is received in the dural venous system, superficial system, and deep system? Dural venous sinus, in superficial system and deep system. Superficial system, superior cerebral vein, middle cerebral vein, and inferior cerebral vein. This is superficial system. Superficial system and deep system. Superficial system they take superior cerebral vein, middle cerebral vein, and inferior cerebral vein. And deep system, superior cerebral vein, middle cerebral vein, inferior cerebral vein. And deep system is medullary vein, great cerebral vein of Galen. What is the structure in the arrow? It is epiglottis. Show the parieto-occipital, parieto-occipital, mm, parieto-occipital sinus. This is which neurological area is located in the precentral primary motor area, primary motor cortex. Which part of the body represents the medial side of the motor area, lower limb, lower limb. Upper motor and lower motor. In upper motor neuron lesion, lower part of the face will be affected opposite side. And in lower motor neuron lesion, both upper and lower part of the face will be affected same side because in lower motor neuron lesion only in lower motor neuron lesion, both upper and lower part of the face will be affected because ipsilateral because in the upper motor they have the dual supply. Other than circle of wheels, what other basilo? No, this is actually basilar. This is middle cerebral artery. Middle. Describe the course of the vertebral. It crosses transversely across the posterior arch of the atlas. It crosses transversely across the posterior arch of the atlas. The vertebral artery enters the skull through the foramen magnum. Inside the skull, the vertebral artery passes upward, forward, and medially in the subarachnoid space in the anterior aspect of the medulla oblongata, and they reach at the lower border of the pons, and then they form the basilar artery. Okay. 11, glossopharyngeal, vagus, and accessory nerve. You can go for break now. Rapidly, also it will take another 10 15. Okay. I will send link, then you can join. Oh. জয় জয় অরুণাচলে আলোকিত শোভা জাহ্নবী তপবনে জগমনোলোভা লক্ষ্মী মামেব নিকটে অদ্বৈত বসছত্রধর বসিয়াছে গৌরাচার রত্ন সিংহাসন আরতি করে আদি দেব বনে নর হরি আদি করি শ্যামল তুলা সঞ্জয় মুকুন্দ বাসী ঘোষয়াদি গায় শঙ্খ বাজে ঘণ্টা বাজে বাজে করতাল মধুর মৃদঙ্গ বাজে পরম রসায়ন বহু কোটি চন্দ্র বদনয়োজ্জ্বল হরে সরবণ শিব সুখ Krishna Hare 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 Rama 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 Hare Hare Jai Gauranitai 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 Jai Gauranitai Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare, Hare Krishna, Krishna Krishna, Hare Hare. Hare Rama, Rama Rama, Hare Hare, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Hare Rama, Rama Rama, Hare Hare. Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Rama Rama, Hare Hare, Hare Krishna, Krishna Krishna, Hare Hare. Hare Rama, Hare Rama, Rama Rama, Hare Hare Krishna, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama, Hare Rama, Rama Rama, Hare Hare. Jaya Radha Madhava, Radha Madhava, Radha Madhava, Jaya Radha Madhava, Jaya Panchatattva, Jaya Panchatattva, Panchatattva, Jaya Panchatattva, Jaya Jagannatha, Jaya Jagannatha, Jaya Gurudeva, Jaya Murtha. Sai Gaura Hari Bol, Hari Bol, Hari Bol, Hari Bol. Namaste Narasimhaya, Namaste Narasimhaya, Tolada Lada Dai, Tolada Lada Dai. Hiranyakashipurvakshaः Hiranyakashipurvakshaः Shilatangkanakalaye Shilatangkanakalaye Itore Simha Padatore Simha Itore Simha Padatore Simha Jato jato jami tato nashinho, jato jato jami tato nashinho, bohir nishinho vidaye nashinho, bohir nishinho vidaye nashinho, narasimha madim sharanam, tokonte narasimha madim sharanam, tokonte. তব কর কমল ধরে নাথা অদ্ভুত সিংহ দলিত হিরণ্যকশিপু তানুলিঙ্গ কেশবধৃত নরহরি রূপ জয় জগদীশ হরে জয় জগদীশ হরে জয় জগদীশ হরে জয় সিংহদেব জয় সিংহদেব জয় নর হরি জয় নর হরি হর হরি জয় নর হরি জয় প্রহ্লাদ মহারাজ প্রহ্লাদ মহারাজ প্রহ্লাদ মহারাজ জয় ভক্ত প্রহ্লাদ নিতাই গৌর হরি বল হরি বল হরি বল হরি বল জয় নৃসিংহ শ্রী নৃসিংহ জয় 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 নৃসিংহ উগ্রং বীরং মহাবিষ্ণুং জ্বলন্तं সর্বতোমুখং নৃসিংহং ভীষণং ভদ্রং মৃত্যুর্নমাম্যহং জয় নৃসিংহ শ্রী নৃসিংহ জয় 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 নৃসিংহ উগ্রং বীরং মহাবিষ্ণুং জ্বলন্तं সর্বতোমুখং নৃসিংহং ভীষণং ভদ্রং মৃত্যুর্নমাম্যহং জয় নৃসিংহ শ্রী নৃসিংহ জয় 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 নৃসিংহ উগ্রং বীরং মহাবিষ্ণুং জ্বলন্तं সর্বতোমুখং নৃসিংহং ভীষণং ভদ্রং মৃত্যুর্নমাম্যহং जय सर्वविघ्न विनाशकारी मंत्र भगवान नृसिंहदेव की जय प्रहलाद महाराज की जय निताय गौर शिखनाथ प्रेमानंदे हरि हरि बोल। জয় কুঞ্জ বিহারী জয় রাধা মাধব জয় কুঞ্জ বিহারী জয় গোপী জন বল্লভ গিরিবরধারী জয় গোপী জন বল্লভ গিরিবরধারী জয় রাধা মাধব জয় কুঞ্জ বিহারী যশোদানন্দন ব্রজজনরঞ্জন যশোদানন্দন ব্রজজনরঞ্জন যশোদানন্দন ব্রজজনরঞ্জন যশোদানন্দন ব্রজজনরঞ্জন যমুনা তীরবনা চারি যমুনা তীর বনাচারি জয় রাধা মাধব জয় কুঞ্জ বিহারী হরে কৃষ্ণ 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 হরে 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 রাম 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 হরে 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 কৃষ্ণ 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 হরে 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 রাম 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 হরে হরে জয় রাধা মাধব জয় রাধা মাধব রাধা মাধব জয় রাধা মাধব কুঞ্জ বিহারী জয় কুঞ্জ বিহারী কুঞ্জ বিহারী জয় কুঞ্জ বিহারী গৌর হরি বল হরি বল হরি বল নিতাই গৌর হরি বল হরি বল হরি বল হরি বল। ओम विष्णुपाद अष्टोत्तर शब्द श्रीमद् जय कथा स्वामी गुरु महाराज की जय। इस्कॉन प्रतिष्ठाता आचार्य अभय चरणानंद भक्ति वेदांत स्वामी श्रील प्रभुपाद की जय। इस्कॉन गुरु परंपरा की जय। षड गोस्वामी वृंद की जय। देवादेव महादेव की जय। श्याम कुंड राधा कुंड गिरि गोवर्धन धाम पुरधाम मायापुरधाम वृंदावन धाम की जय। जय जय विष्णु भक्त प्रधानी तुलसी महारानी की जय। जय जय सर्वभूति मद्रास भगवान सिंहदेव की जय। जय जय जगन्नाथ बलदेव सुभद्रा महारानी की जय। पंचतत्व भगवान की जय। प्रेम से कहो श्री कृष्ण चैतन्य प्रभु नित्यानंद श्री अद्वैत गदाधर श्रीवासादि श्री गौर भक्त वृंद की जय। जय जय दामोदर भगवान यशोदा माता की जय। जय जय लालगोपाल भगवान की जय। जय जय जगन्नाथ बलदेव सुभद्रा महारानी की जय। श्री श्री राधा माधव की जय। श्री श्री राधा माधव श्रद्धा काली आरती की जय। निताई गौर प्रेमानंदे हरि हरि बोल। Hare Krishna, Hare Krishna, Krishna Krishna, Hare Hare, Hare Rama,